My name is Brandon Barlow, and today my presentation for advanced procedures is on breast cancer and mammography and how it has helped millions of women today survive breast cancer. So I decided to do my case study on my mom, Dodie Barlow. She had breast cancer back in 1996. She was 50 years old. She felt a lump on her breast. She went in to see her doctor. Her doctor sent her out for a mammogram, and her mammogram showed that she had something abnormal on it. So then she came back to her doctor. Her doctor then sent her out to a specialist, an oncologist, and he thought maybe it was a cyst, so he removed fluid. Turned out that it wasn't a cyst, so they ended up doing a biopsy, and the biopsy came back that she did have cancer. So they set up a plan. The plan was to first remove the tumor. So they removed the tumor. Then she had chemotherapy. She had chemotherapy for about 3 months, twice a week. And then she had radiation 5 days a week for 6 weeks. She is now 25 years cancer-free and happy as can be. Common types of breast cancer. So a couple common types here. Ductal carcinoma in situ, lobular carcinoma in situ, invasive ductal carcinoma, and the last one, invasive lobular carcinoma. So my mom had invasive ductal carcinoma, and it's cancer that starts in the milk duct and usually spreads to other areas of the breast and can even spread outside the breast to other parts of the body. It's the most common type of breast cancer. 8 in 10 that are diagnosed with breast cancer usually have this invasive ductal carcinoma. So in my mom's case, hers did spread. They ended up removing a few of her lymph nodes as well as the tumor in her breast. And I think she said 2 or 3 came back with cancer, lymph nodes. All right, so mammography. Mammography is the most sensitive and accurate screening modality available for detecting early breast cancer. I'm thankful for mammography because it's saved my mom's life, and it's also saved, probably millions of women's lives as well. So I'm grateful for this modality, and it's the process of using low energy X-rays to examine the human breast. So kind of how it works is women, they'll put their breast on the plate, and then what the mammogram does is it smushes the breast down. So it's kind of like this. This is kind of how it would work. And then the X-ray would come down straight through the breast, and then you would get the X-ray, and then they would do a side view, a lateral view as well. So just kind of a fun way to show it with a cupcake breast. And mammography is used as a diagnostic screening tool, so we've covered that a little bit. Women 50 or older should get annual checkups to make sure nothing is changing or anything abnormal in their breast. And most important innovation in breast cancer control since the mastectomy back in 1898. So right here I have 3 mammograms. You can see the first one is a normal mammogram. Second one is a benign cyst. This is what they thought my mom had, but it turned out to be actual cancer. And so the awesome thing with mammograms is that they can see exactly where the tumor is, and that's important because when they come in here and they're doing the surgery and trying to find exactly where the tumor is, and they're getting all out, they come in and they just take a little slice of the breast there, and then they go in there and they remove, I'm not a surgeon. Oh, I just ruined my breast. And they removed the cyst, which we use as a gumball. I'm not a very good surgeon. I just ruined this nice breast, but I'll put it back together. And that was just kind of the way mammogram is used. So the surgeon can see exactly where the tumor is, so he knows exactly where to go in, and he can remove it, make sure he gets all of the cancer out so that it doesn't come back. All right, so on to the last slide. This is prevention. Cancer prevention is action taken to lower the chances of getting cancer. Obviously, we have the normal cancer risk factors. You shouldn't smoke, shouldn't be overweight, and you should exercise. All good things to do to help prevent cancer. If it runs in your family, you should talk to your doctor about prevention. You should have annual checkups. Mammograms obviously is the number one checkup that you should be doing, especially if it runs in your family. Mrs. B, you talked about it in your lecture that they're kind of saying maybe starting at age 40 you should start kind of having mammograms, but you said it's a lot of radiation, so 45 if you feel like it kind of runs in your family. Eating right is important. It's important in everything we do. Obviously, eating the right things, staying away from foods that can cause cancer. Less exposure to estrogen. If you get high amounts of estrogen, they say that can lead to breast cancer. You can also, many women today have chosen to do mastectomies, and that is to remove all of the tissue of the breast. And a famous person that did it was Angelina Jolie. She did it, and because it ran in her family, and she didn't want to even take that chance. And then finally, there's still trials going on today to try to see if there's better options or better ways to prevent cancer. And so I just want to end by saying that I'm thankful for advanced modalities such as mammogram in radiography. For obviously, my mom is alive because of it today. Many women as well, millions, probably maybe billions, are still alive today because of mammography. And I think it's an important modality for that reason, that it saves lives. So I just want to say thanks, and I hope you enjoyed the slides.